Welcome to The Explainer. Today we're diving right into how modern, gentle dental technology can completely transform your teeth and honestly restore your confidence. We're talking about crowning your smile, something that affects so many of us, yet we rarely talk about it openly.
So let me ask you, have you ever caught yourself keeping your lips tightly sealed in a photo? Or maybe you've been actively avoiding your absolute favorite foods? Let's be real about the emotional and physical toll here. Whether you're dealing with a sensitive, damaged, or even a missing tooth, hiding your smile is exhausting. It takes a massive toll on your daily life. But here's the best part. You literally do not have to live like that anymore.
To take all the fear and mystery out of this, here's our roadmap for today. We'll cover why we hide our smiles, what a dental crown actually is, bridging the dental gap, the step-by-step procedure, risks and alternatives, and finally, caring for your smile. Kicking things off with Section 1, why hide your smile? Let's look at the physical and emotional toll of damaged teeth. Over time, our teeth just take a beating, whether it's an old sports injury or just the natural wear and tear of everyday life. Now, in the past, fixing a badly damaged tooth meant a pretty scary visit, and you'd often walk away with this bulky, obvious metal cap that looked, well, kind of like a pirate's treasure. Yikes. But modern dentistry has completely flipped the script. Today, it is all about calming, fear-free, totally judgment-free environments. And the materials? We're talking state-of-the-art porcelain and ceramics that flawlessly match your natural teeth. It's a total game changer.
Moving right along to Section 2. What is a dental crown? The hero for weakened teeth.
Basically, you can think of a dental crown as a custom-made, super durable little helmet for your tooth. Say you've got a severe crack or decay, or maybe you just had a root canal. A dental expert will come in, carefully shape what's left of your natural tooth, and then place this protective cap right over the top of it. It perfectly encases the tooth, shielding it from any further damage while instantly upgrading how it looks.
And the materials they use today are just mind-blowing. They craft these from porcelain, zirconia, gold alloys, or even a combination of porcelain and metal. But the real magic is how they color match it. They tune the color so precisely to the rest of your smile that it creates this perfect optical illusion. Seriously, when you look in the mirror, not even you will be able to spot the crown. It just looks and feels exactly like your own tooth.
All right, Section 3, bridging the dental gap. Solutions for missing teeth. So what if the tooth was too far gone? What if it couldn't be saved and is just missing completely? Well, that is exactly where a dental bridge comes in. A bridge does exactly what it sounds like. It bridges the empty space. It uses beautiful, custom crowns placed over your natural, healthy teeth on either side of the gap. Those healthy teeth act as your anchors, and they securely hold a brand new, custom replacement tooth perfectly suspended right in the middle. Now, why is filling that gap so incredibly crucial? Because of something called the cascade effect. It's fascinating, but also pretty painful if ignored. When you lose a tooth, that empty gap allows your remaining teeth to slowly drift and shift out of their normal positions. That shifting completely destabilizes your bite, which can easily lead to chronic jaw pain down the road. So filling that space isn't just about looking good, it's a structural necessity to keep your whole mouth functioning properly. Which brings us to Section 4, the step-by-step procedure. Getting this done in just 2 highly comfortable visits. I know what you're probably thinking. Is this gonna hurt, or how much of my life is this gonna take up? Honestly, it's incredibly manageable. The whole thing is basically broken down into 2 predictable visits. On visit 1, they use a bit of local anesthetic, so you really don't feel a thing. They shape the tooth and take a highly accurate digital scan or impression. You'll leave that day with a temporary cap. Then, while you're out living your life, a specialized lab is hand sculpting your permanent piece. A couple of weeks later, on visit 2, they just pop off that temporary cap, check the fit in your bite, and use dental cement to securely bond the permanent one into place. Easy.
And I have to say, the environment where you get this done makes all the difference in the world. Clinics like My Gentle Dentist at Arana Hills are actively changing the whole narrative around dental visits. They deliberately create spaces that are calming, hyper-patient focused, and, this is the big one, completely judgment-free. It's all about making sure you feel safe, comfortable, and actually heard throughout the entire step-by-step process.
Now for Section 5, risks, recovery, and alternatives, the full picture of your dental health. Being totally transparent is absolutely vital when making any health decision. While today's modern crowns are incredibly reliable, complications can still happen. A crown might come loose and fall off, You might develop underlying tooth decay, or you could deal with sore, swollen gums if the fit isn't quite right. And it is always a good idea to ask your prosthodontist about alternative options. Depending on your specific situation, things like removable dentures, cosmetic veneers, or even just rebuilding the tooth with filling material might actually be a better path for you.
However, and this is a big however, you have to weigh those options against the risk of delaying treatment altogether. If you put off getting a necessary permanent crown, especially after something major like a root canal, you are running a significantly higher chance of that weakened tooth just breaking. Put simply, the longer you wait, the higher the risk that you'll need the tooth removed entirely.
Let's wrap things up with Section 6, Caring for Your Smile. Simple maintenance for long-lasting results.
So once that beautiful new crown or bridge is perfectly bonded into place, how do you actually take care of it? Well, it's surprisingly simple, and it all revolves around the number 6. Treat your new dental work exactly like your natural teeth. Brush, floss, and, here's the 6, commit to your routine 6 monthly checkups and cleans. Keeping that rhythm is what keeps the underlying gums healthy and makes sure your new smile lasts for years.
High-quality care like this should absolutely be accessible. So if you're finally ready to fix that smile, the friendly reception team at My Gentle Dentist is waiting for you. You can find them at Shop 15B inside the Arana Hills Plaza. Just give them a call at 07-3506-1234 or check them out online at mygentledentistaranahills.com.au. They even offer super flexible payment plans to make it work for you.
And just a quick side note, if you ever need free 24/7 Australian health advice, or you have urgent questions about any medical procedure, remember you can always call the Health Direct hotline. That number is 1-800-022-222. We've covered a ton of ground in this explainer today, haven't we? From those incredible seamless materials they use in crowns to how a bridge can literally stop the cascade effect in its tracks. You really shouldn't have to go through life putting up with constant dental discomfort or hiding away your greatest asset. So I want to leave you with one final thought. What is the true everyday cost of hiding your smile? And more importantly, are you finally ready to let the experts help you wear it with pride? Thanks for hanging out with me for this explainer, and keep smiling.